What if there was a health condition that was basically a silent warning sign, but at the same time was also a golden opportunity? Well, there is. Today, we're talking all about prediabetes, a condition that for millions of people is the absolute key to preventing a much more serious lifelong disease. Okay, let's just start with a number, a huge one, 98 million. According to the CDC, that's how many adults in the United States are walking around with prediabetes right now. I mean, that is more than a third of the entire adult population. It's staggering. But here's the part that really gets me, and you can see it right here. A massive 80% of those people have no clue they even have it. It's a hidden condition. And that silence, well, that's exactly why we need to be talking about it. So what is prediabetes, really? What is this early warning system our body is trying to send us? Let's get into it. To put it simply, prediabetes is that gray area. It's when your blood sugar is higher than it should be, but it hasn't quite crossed that line into a type 2 diabetes diagnosis. Think of it like your car's check engine light. It's not a breakdown, but it's a clear signal that you need to pay attention. And this isn't just guesswork. Doctors have really specific ways to measure this. You're looking at the main blood tests they use, like fasting glucose or an A1C. You can see these super clear numerical ranges that show exactly where you fall, whether it's in the normal range, that prediabetes warning zone, or a full diabetes diagnosis. These numbers tell the story of what's going on inside your body. So why is your blood sugar high in the first place? Well, it all boils down to one thing: insulin resistance. Normally, the hormone insulin acts like a key that lets sugar from your blood into your cells to be used for energy. But with insulin resistance, that key starts to get a little rusty. It doesn't work as well, so the sugar can't get into the cells and it ends up building up in your bloodstream instead. And this is why that check engine light is so incredibly important. According to the Mayo Clinic, if nothing changes, about 70% of people with prediabetes will eventually develop type 2 diabetes. That's not a small number. This is a genuine fork in the road for your long-term health. That statistic makes it pretty clear just how high the stakes are, right? So the next big question is, who should be concerned? Who's actually at risk here? Let's take a look. And as we go through these next few slides, I want you to just ask yourself this one simple question. Do any of these things sound familiar to me? All right, first up, there are some factors that are just out of our control. Your risk just naturally goes up after you turn 45. Having a parent or a sibling with type 2 diabetes, yeah, that bumps up your personal risk too. And your background matters. Certain ethnicities, like people of Asian descent, just have a higher genetic risk. Now, here's a really critical point that often gets missed. When we talk about body mass index, or BMI, the risk for Western populations really starts to increase at a BMI of 25 or more. But for Asian populations, that risk starts at a lower BMI of just 23. That's a super important distinction to be aware of. Okay, but then you have all the risk factors that you can do something about. Things like being overweight, not getting enough exercise, and the official line there is less than 150 minutes a week, or having high blood pressure. Those are big ones. And for women, having had gestational diabetes during a pregnancy or having PCOS are also major risk factors. Okay, so we've talked about the problem, we've talked about the risks. Now let's get to the best part, the solution. This is where prediabetes stops being a warning and starts being that golden opportunity we mentioned. I mean, this quote just says it all, doesn't it? Prediabetes is not a life sentence. It is your window of opportunity. It's your chance to step in and make a powerful change for your future. And the best news of all, science has given us a super clear, proven roadmap. It really comes down to these three things. 1, aim for a modest weight loss, just 5 to 7%. It makes a huge difference. 2, get moving for at least 150 minutes a week. That's just 30 minutes, 5 days a week. And 3, shift to a healthier way of eating, like the DASH or Mediterranean diets. Each of these steps helps make that rusty key, your insulin, work better again. And if you're wondering just how powerful these simple changes are, get this. A huge, groundbreaking study called the Diabetes Prevention Program found that lifestyle changes were actually 31% more effective than the leading medication used for this. I mean, that's just incredible. And it all leads to this amazing number, 58%. By making those lifestyle changes we just talked about, you can slash your risk of progressing to type 2 diabetes by 58%. That is a massive, life-changing impact that is completely within your control. So, we know what the problem is, we know what the solution is. The only thing left is, How do you take that very first step? It starts with finding out where you stand. It starts with getting screened. The official guidelines recommend screening for all adults 45 and up, but you should start earlier, from age 35, if you're overweight. And remember, that's a BMI of 23 or more for Asians, and you have at least one other risk factor. Look, the bottom line is simple. Talk to your doctor. A conversation with your healthcare provider is the first, most important step. Finding out you have prediabetes isn't bad news. It's empowering news. It gives you the information you need to take control. Early detection is, without a doubt, your most powerful tool. So when you boil it all down, prediabetes isn't a final verdict. It's a question. It's your body's early warning system giving you that golden opportunity to change course. The only real question left is, what's your answer going to be?